Okay. A lot of what I wrote down during the last couple of days, I think Linda's covered in terms of research needs. I'll try not to be too redundant. To start out with, I think, EPA has a real interest in this area. One of our national research programs, the Sustainable Healthy Communities Research Program, really strives to provide communities with information to make decisions about how they spend their resources and so forth. So things like siting schools and green space and interactions with the natural and built environments and so forth. And so this idea of the effects of the early environment on lifelong health, as Linda's talked about so much, has risen, in that program as well. And we have a relatively small research program going on in-house, but we do have that as an interest. There's also a cross-cutting children's health, environmental health roadmap in EPA that has throughout it the ideas of the environmental effects on the metabolic syndrome, not just obesity, but the developmental origins of future health and disease, as well as co-funding the Children's Environmental Health Centers with NIEHS. One of the things that really strikes me, being a developmental toxicologist at EPA, is that our standard regulatory developmental tox tests would miss most of this. I know Linda has mentioned this, but we do teratology studies. We take these fetuses from the mother, just before they would be born. Even multi-generational studies don't follow the offspring very long. And even if we did, things like insulin resistance or elevated blood pressure or changes in body composition that didn't affect body weight, which we have seen in animal models and humans, would not be detected at all. And even in the past, when there was elevated body weight in some of these studies, it was kind of, thought to be not an adverse effect. So that's one of the things that strikes me the most, is that we could be missing some of the biggest problems that are now in the human population in children, and with obesity and diabetes and other things. I think in terms of developmental exposures, we need to know something about critical periods. We don't know that yet. Is it all prenatal? Is it all, even if it's all prenatal in human? In our animal models, a lot of what happens in utero in humans happens postnatally in the animal models, especially neurobehavioral development. And so, what kind of animal models do we need to model the human situation the best that we can? I think, even though there are a number of good examples now, and Bruce Bloomberg's story is always really great, and the TBT, the tributyl-10 story, DES, and now BPA, there's still some inconsistency among the studies that are published, and there's probably a lot of reasons for that. I mean, it's a difficult model in a lot of ways. Linda mentioned species and strain differences, and those surely exist, although we haven't figured them out yet. What kind of diet do you use for your animal models? Do you need to put them on a high-fat diet to, sort of stress the system and show that they respond differently if they have a high caloric intake? What's the exposure period? And what's the dose? So we talk about non-monotonic dose responses, and I think this is a good example where you might even expect those, because at some low level, you might be stimulating some pathway that leads to obesity, but as you increase the dose, you're going to kick in other toxic mechanisms that at some point is going to start driving the weight down. So you're going to cross that line and go back into weight loss at some point. It's non-monotonic in a dose response, but it's increasing toxicity throughout the whole range. It's just that particular endpoint that you're looking at. So if you go too high, and someone mentioned this yesterday, Dr. Rubin, if you start out at that high dose, you would say there's no effect, or even that they're losing weight. But so it's not an easy thing to set up. I think we've done some work with PFOA that was mentioned in a couple of the studies, and there had been a paper from EPA a few years ago showing transient increased body weight in female offspring from mice exposed to PFOA. And we set out to replicate that, and in fact, even though we did 3 different blocks, we tried high-fat diet, we essentially could not replicate that. I think the presenter that presented the Obelix study talked about putting PFOA mice onto a high-fat diet, and in fact, it decreased their weight gain instead of increasing it. So it's we have a ways to go to parse this out, and I think one of the things we need to do is really understand the mechanisms. There are more than one. I mean, we didn't talk a lot about epigenetics today. It was interesting. Thursday and Friday last week, there was another IOM-sponsored meeting in Washington where they looked specifically at the developmental origins of obesity, and they covered these sorts of things a little more than we did here, but it certainly came up as well. Do they always have an endocrine basis? You know, in terms of regulation, we look at estrogen, androgen, thyroid for the most part. I think more and more we need to look at insulin economy and effects on other endocrine systems, and that's been mentioned. So I think we need in animal models are some of the things that we see most often affecting offspring body composition in humans, and a couple of them that came up were maternal obesity, pre-existing obesity prior to pregnancy, gestational weight gain, high gestational weight gain, and gestational diabetes, and how do those things really make them more vulnerable to effects on the offspring of chemical exposures. Also, I think some of us, due to a lot of factors, look at selected endpoints and don't do a whole survey. So I think complete evaluations of especially all the metabolic syndrome aspects, not just obesity, but insulin resistance, we did hear about that, but blood pressure, blood lipids, also effects on the stress response. So the maternal hypothalamic pituitary adrenal axis and maternal stress gets passed on to programming of the infant's stress response, and how does that affect the whole system? We didn't hear much about neurobehavioral cognitive effects, but that was one of the things that, watching the webinar last week, was that some of these studies are showing that these kids that have obesity are scoring substantially worse on cognitive testing and things like that. And so there are other outcomes that, you know, is it just while they're obese, if they lose weight, do they do better, or is it you know, one of many things that's the adverse outcome of the original insult? So there's a lot to be learned there, I think. And again, the animal studies get a little harder when you have to keep them for a year and do all these later tests. So it'd be really good if we could find some early biomarkers. You know, what kinds of early changes that you wouldn't see in our typical tests, but maybe if you're doing genetic or biochemical, genomic or biochemical assays, that you could have some robust biomarkers that would allow us to look through this a lot more quickly. And then you know, a lot of the times the question I hear is, well, what's the attributable risk of the chemical exposure versus calorie intake and exercise and those sorts of things? And so to get some handle on that would be very helpful. Body weight is not a very good endpoint for animal models or humans. The body composition is really important. We heard about sort of the skinny fat phenotype where, you know, but BMI is normal, but fat content is high, and that's been seen in humans as well as the animals. So that's most of what I had to say. I think one of the things that struck me the most was the huge changes in diet, you know, a lot of which I'd known about when we saw Barbara's picture of the, you know, 1950s family versus the, you know, the 21st century family, the difference in what they ate. But even those things that were on that slide from the 50s aren't like that anymore. And so, you know, where do we really go to understand how all that affects the whole picture? So